Hello everyone, and welcome back to our channel. Today we're diving into one of Canada's most urgent public health emergencies, the fentanyl crisis.
Yeah, it's a huge deal. Like, big enough to compare to an entire small city just vanishing. Seriously alarming stuff.
Picture this. You wake up one morning and an entire town's population is gone. That's basically what's happened here. Nearly 50,000 Canadians have died from opioid overdoses between 2016 and mid-2024, most of them involving fentanyl. Today, we'll break down how this crisis exploded, the urgent solutions experts recommend, and most importantly, how you can help turn the tide.
It's heartbreaking, but we need to talk about it. Knowledge is power, after all, and hopefully a lifesaver.
So, from January 2016 to June 2024, nearly 50,000 opioid-related deaths occurred in Canada.
That's a shocking number. And if we drill down a little more...
Exactly. Of those, 49,105 were linked specifically to fentanyl. By 2024, fentanyl was involved in a whopping 79% of all opioid deaths, a 39% jump since 2016. That said, there's been an 11% drop in daily overdose deaths compared to last year, which is a sliver of good news. But we're still losing an average of 21 Canadians every day.
Yeah, those statistics aren't just numbers. They represent real families, friends, and neighbors who are suffering unimaginable losses.
Absolutely. It's a very real human tragedy. Let's talk fentanyl itself. It can be up to 50 times stronger than heroin, and it's often mixed into other drugs, totally unregulated.
Wow, that's like playing Russian roulette every time someone uses.
Right. Experts point to three key factors driving this epidemic. 1. Unregulated supply. No checks or balances on potency. 2. COVID-19 disruptions. Lockdowns cut people off from essential harm reduction services. And 3. Domestic production. Fentanyl is cheap to produce and has flooded the market, outpacing demand.
And you mentioned that 11% drop in overdose deaths, but it's like the glass is only slightly less empty than before. Health Canada says the data is still fragile.
Exactly. The crisis isn't disappearing. If anything, we need to double down on solutions. According to frontline experts, there are practical, evidence-based measures that can literally save thousands of lives.
Here we go. Solutions. That's what I'm talking about. We need some hope after all those terrifying stats.
First up, expand harm reduction services. Things like safe consumption sites and safe supply programs, these offer regulated pharmaceutical-grade alternatives and medical supervision, shown to reduce fatalities and connect more people to treatment.
The catch is that they need funding and political will to really expand.
Precisely. Second, enhance treatment accessibility. We're talking more detox and rehab options because waiting lists can be insane. Also, removing financial barriers, treatment for substance use disorder should be treated like any other medical condition.
And what about folks who can't or won't seek help?
That's where involuntary addiction care infrastructure might help. This allows individuals with severe addiction or mental health issues to be detained and treated without consent if deemed necessary for their safety or the safety of others. It's controversial, of course, but for those at extreme risk, a robust and ethically guided system could literally save lives.
It's definitely tricky, but if done with compassion, it can be a lifeline.
Next, improve data collection and monitoring. We need real-time reports on overdose rates so we can adjust strategies fast, and there has to be collaboration between federal, provincial, and local health authorities.
This one's a no-brainer. If we don't have accurate data, we're basically trying to fix a problem blindfolded.
Right, then public education campaigns to destigmatize addiction and share practical info on seeking help. That means partnering with community groups, media outlets, even influencers to spread the word.
And let's be honest, social media is powerful. Might as well use it for good.
Absolutely. We also need to address underlying social factors, integrate mental health services, housing assistance, and income support, especially for vulnerable populations. And collaboration with social service agencies is huge.
Because it's not just about saying stop using drugs, it's about helping people with their overall well-being.
That's absolutely correct. We must also encourage collaborative efforts with healthcare providers, law enforcement, policymakers, and community groups. Include people with lived experience. They know what really works on the ground. Plus, we need to support ongoing research into new treatments and alternatives, scaling up the stuff that proves effective.
Totally. If something's not working, scrap it. If it's working, grow it. That's a practical, straightforward strategy.
Finally, maintain advocacy and engagement. That means keeping the conversation going through forums, media, citizen groups, so we don't let the issue fade into the background.
Out of sight, out of mind. That's the last thing we need here.
Exactly. The fentanyl crisis is about real people, not just numbers. We can make a difference by expanding harm reduction, improving treatment, and tackling stigma. By sharing this video or podcast in this format, you're pushing leaders to fund these life-saving solutions. If you or someone you know is at risk, please reach out. There's help out there.
And remember, we're all in this together. The more we talk, share, and act, the more lives we save. Thank you for tuning in. Stay safe, and we'll catch you next time.